Hi, I'm Dr. Tom Entwistle, and welcome back. We've got some really good information for you today. One of the questions that we get the most is, why isn't my back pain going away? It's a great question. It's one of my absolute favorites. And what can I actually do to fix it? Well, that second question actually points to what one of the problems is. So why doesn't my back pain go away? So we're going to actually shift gears just a little bit and go to how we actually take care of our bodies, right? One of the interesting things is that we actually take better care of our cars than our bodies. Now, why do I say that, right? Well, we all pretty much know how to take care of our cars. What do we have to do? We have to change the oil, rotate the tires, get tune-ups, right? All of those things, all of us know how to do that. We all drive cars. We all know what we need to do to take care of them. When it comes to our bodies, one of the challenges we have is we think we know how to take care of our bodies. So why do I say it that way? Well, there's actually only one part of our body that we take care of on a regular basis. We do it every day, twice a day, and we did it from the time that we were little boys and girls, right? What is that? I'll give you a hint. It's our teeth, right? We learned, from mom or dad, or maybe one of our older siblings, and that we need to brush our teeth on a regular basis, right? So once we started doing that regularly, mom or dad stopped checking on us. They trusted us to just keep doing that, and we do it. And we still do it today, don't we? And it's really, really important. We also go to the dentist on a regular basis, or at least we know we should, right? How often do you go? If you go regularly, probably every 6 months. Now, the question is, do you wait for your teeth to hurt to go to the dentist? Probably not. And it wouldn't make sense to do that, right? You go because you want to maintain them. Well, that's a really good reason. You want to take care of your teeth, right? Because you want them to function and you don't want to have to replace them. Now, you could if you needed to, but it's so much better if you don't, if you can use your original equipment. Well, that goes for the rest of the body too. If we can use our original equipment and have it last throughout the course of our lives, we are so much better off than a situation where we have to look for intervention, maybe adding replacement parts to these bodies. Not the best scenario. So the challenge is how we take care of our bodies. So just like we learned how to brush our teeth when we were younger, we also learned how to take care of our bodies. And that system, if you will, was based entirely on how we felt, right? If we had a fever or weren't feeling well, mom or dad would take us to the doctor. The doctor would give us something or do something for us. We'd go home. We'd start to feel a little bit better, right? Would we go back to the doctor at that point? No. We figure, hey, I'm all set now. We would wait to go back to the doctor until that same scenario started again. Maybe again we felt bad, maybe a fever again, or maybe some other issue that we would go back to the doctor for. But what prompted us to do that was symptoms, was not feeling well. So what we equate to having a lot of health is having low symptoms. Lots of health if we have little to no symptoms. But if we have a lot of symptoms, we think we have less health. Now, the challenge is with our bodies is that most of the time, when we have bad things happening in our bodies, we don't feel them initially. In fact, we don't feel them until very late in the game. I'll give you an example. Do you know what the top two causes of death we have in this country are? What do you think? Okay. Number one, take a guess. Yeah, it's heart disease. Heart disease is absolutely number one. Number two is cancer. Okay, so heart disease and cancer. Now, when somebody has heart disease, how do they typically find out that they have it? What will typically happen? Yeah, it's a heart attack, right? And in 50% of the cases, that heart attack is fatal, right? It's happened in my family, probably yours too. Okay, for me, it was my grandfather, 71 years old. He was coming off the golf course, right? Had a massive heart attack. They were unable to resuscitate him, and he passed, and he was gone. And that was his first symptom that he had heart disease. He thought he was in great health. We thought he was in great health. He was playing golf in the middle of January with his buddies at 71 years old. Okay, strong guy, right? But obviously he was very sick if he had a fatal heart attack, right? Cancer is another great example. Question, can you have tumors in the body and not know it? And the answer, of course, is yes, right? And very often when someone finds out they have cancer, it's usually late in the game, isn't it? Okay, so the symptoms come on late. So if we're waiting for symptoms to come on, okay, typically problems can be very advanced, right, in our bodies and can be life-threatening. And certainly when it comes to heart disease, it can be life-ending, okay, life-ending. And it can even happen, obviously, with cancer too, if it's discovered too late and there's no hope for treatment. So when it comes to the rest of our body, well, we need to understand how the body works in order to take better care of it. And how it relates to our back pain is a great example of that. So typically, the symptoms that we might feel, that back pain, maybe that pain shooting down the leg, that sciatic type pain, or maybe neck pain, that typically when it first shows itself, whether it be from a trauma, whether it be from overuse, or whether it comes on gradually over time, well, we don't feel those symptoms typically on a regular basis. We'll feel some symptoms, the symptoms go away. Now, when the symptoms go away, what do we think? Yeah, we think the problem has gone, right? In fact, every day I talk to patients and they sit, right where you're sitting, the same vantage point, okay? And they say to me, well, doc, I got this back problem that comes and goes. And what they're really saying is what's coming and going is not the problem, is it? What they're actually saying is I have this back pain or these symptoms that come and go. And that's a classic presentation, if you will, of a back issue where the symptoms come and go, right? Again, when we think we have a lot of symptoms, we have less health, no symptoms, we're fine. So when the back pain goes away, we're like, whoa, hey, that wasn't so bad. But typically over time, the back pain, when it comes back, gets worse and it lasts for a longer period of time. Maybe it goes away again, but when it comes back again, it might come back even sooner and even to a greater level of pain. So what do we need to do to take care of the body, and why is that happening? Well, those problems are developing. That back problem is continuing to get worse. The symptoms are coming and going. The problem isn't going anywhere. So if we want to actually take care of that problem, we have to first understand that the symptoms vary, right? And how much pain we have is not an indication of how much problem we have. So where does it start? It starts by first getting evaluated. You need to find out where you're at. So what do you have to do that? Well, you need to find a place, find an office, okay, that will do a consultation with you first, right? To find out what's going on, how long you've been suffering, what your medical history is, your history of trauma, okay? What's happened to you in the past. And then with that evaluation, it can determine whether or not it makes sense to go ahead and do an examination and most likely some x-rays, right? In order to make a thorough determination of where your body is at that moment. So that's always going to be the first step, because unless we know where we're beginning, right, where everything is at this very moment in time, then we can't determine a good path to get you back to where you need to be. We don't know what treatments might be necessary. We don't know the best course of treatment, and also how long any particular treatments would actually take, right? And what you could be doing on your own as well to help support those treatments and help to actually keep you healthier once you get there. So why is that back pain not going away? Is because often we tend to treat just the symptoms, just the pain. And that's kind of easy to do, isn't it? Right? It's what we're kind of been trained to do, again, from when we were little boys and girls. Treat those symptoms. Take some medication for that. Maybe use a heating pad, or maybe just rest for a couple of days until that pain goes away. So that's certainly one way to approach it. The challenge with that is, again, we're not doing anything to assist or to address the underlying problem, simply the symptoms. And sometimes that symptom relief can be effective, right? Maybe we even take a course of steroids or some other type of medication. The pain goes away and we continue on with our activities. But we've got to figure out what's going on. Why does it keep coming back? Because it never goes anywhere. Those problems are progressive and they will get worse over time. Whatever you happen to be suffering with, or whoever you know that may be suffering with an issue, that issue will never be easier to treat than it is right now. Because with time, the problems progress. That's just the nature of the arthritic changes and scar tissue and damage that forms over time. Those joints get more and more unhealthy, right, over time because the issues continue to develop. And when we look at, for instance, vertebrae in the spine, these happen to be a little model of two bones in the spine. So if you're looking from behind and you feel those bumps down someone's back, that would be the view. This way, okay, we're looking from the front of the body. So we have the individual bones, discs in between. Those are the cushions. Those are the things that sometimes can be herniated, right? Or slip disc. You've probably heard that. And then, of course, we have the nerve roots that pass out between the bones, right? So we need bones to be moving. When they're moving, they're healthy. It keeps the discs healthy, the bones healthy, the nerves healthy, and the body functions the way it's designed to. When these bones get stuck, then we start that degenerative process, the early arthritic changes that happen in the body. And again, typically, we don't feel a lot of that, right, as those problems are developing. So we need to find out what's going on, need to evaluate it closely, and then determine what stage of degeneration, how long those problems have been there, and then we can actually come up with a cohesive plan in order to, number one, address the damage that's been done. And secondly, change the way the body is functioning to avoid future damage. And that two-pronged approach is very, very important. And that's what we do here in our office is we always want to find out where a patient is, okay, what stage that problem is in, and then we chart a course to correct the damage that's been done and also then secondarily correct the way that body has been moving, the issues with the body that caused that damage to begin with. And if we're able to do those two things effectively, we can actually make a comprehensive change so that the problem is actually addressed. The problem is corrected so that you can then function beyond that and live the kind of life you want to live, right? Because when we talk about being healthy, everybody wants to be healthy, right? You want to be healthy, I want to be healthy. In order for that to happen, we need to have a body that's functioning the way it's supposed to. And that's, of course, including, right, the joints, the nerves, the muscles, okay? All of that needs to be happening together. So to make that happen, though, we have to address the underlying cause. We have to figure out what's going on because you want to stay active, don't you? Everybody wants to be healthy, right? Whenever I talk about health, everyone says, well, of course I want to be healthy. And really what we want beyond health is what our health enables us to do, okay? What our health enables us to do. And that's basically to do whatever we want to do, right? Whatever activities we want to participate in, whatever trips we want to take, right? Whatever mountain biking treks we want to take, whatever pickleball games we want to play, and to be able to do that as much as possible. Enjoying time with our family, right? Playing with our grandchildren. I've got two, I know, you need a healthy body to be able to keep up with them, right? So all of that is really what we want. To make that happen, though, we need a healthy body. Now, we only get one of these, right? You get one, I get one. So we need to make sure that we take care of the body, right? Because it's very hard to replace it. Even if you're an Amazon Prime member, I keep checking, but haven't been able to find a new body yet. So find out what's going on, get to the root of the problem, do that consultation, get evaluated so you can actually chart a course to better health and also the kind of life that you want to continue to lead.